Now, let's hear a good oral presentation. Have another admission to tell us about?
We do. We have Miss Doe Jane. She's an 87-year-old Caucasian female who came into our ED last night complaining of epigastric pain for 3 weeks. She has a past medical history significant for irritable bowel syndrome, atrial fibrillation, pancreatitis 40 years ago, status post cholecystectomy, and a history of gastritis. She came in for epigastric pain for 3 weeks. She states that her burning pain began 3 weeks ago, started off as dull, 10 out of 10, radiated to her back. When it started, it was normally associated with some morning nausea, relieved with some PO intake. Nausea has since subsided, but the pain remains constant. She denies any episodes of vomiting, however. No relief with any Lamodal, Tylenol, or Maalox. No changes in her bowel movement. She doesn't complain of any diarrhea or constipation. No bright red blood per rectum, and no tarry black stools.
Okay.
No fevers or chills. Last bowel movement was yesterday, which she said was normal. She has some decreased PO intake, however, for the past 3 days due to her pain. She says she had an EGD several months ago, which, per the patient, showed no evidence of any gastritis. She showed evidence of gastritis. Denies any history of similar symptoms in the past. Treated with a UTI about a month ago with antibiotics. No changes in any urinary symptoms at this time. No hematuria, no dysuria. Again, pain wakes her up from sleep, and pain prevents her from eating for the past 3 days.
Okay.
She thinks that her pain is secondary to her diet or her gastritis. She watches her diet very closely, however, given her irritable bowel, and she tries to avoid any acidic foods. Denies trying any new foods recently other than some watermelon and some strawberries. Thinks that her symptoms may be secondary to her medication as well, although she denies making any changes to her medication recently. Past medical history, as mentioned above. Past surgical history, she had an exploratory laparotomy in 1965 due to pancreatitis, she believes.
Oh, okay.
She had an excision of a spinal schwannoma at C5 in 1975. She had a glomus tumor excision of her left jugular vein in 1990, and she had a cholecystectomy in 2002.
When was that again?
2002.
Oh, okay.
Medications for her hypertension, she's being controlled with Benicar. For atrial fibrillation, she's on propafenone and Coumadin. Her last PT and INR were therapeutic. Hypothyroidism, she's on Synthroid. For her hyperlipidemia, she's on Zocor. For vitamin D deficiency, she's getting vitamin D monthly. And for anemia, she's getting vitamin B12 injections monthly. Allergies, she says she's allergic to nitroglycerin. She had a hypotensive episode. She's allergic to sulfa drugs. She says she had an episode of lockjaw. And she's allergic to iodine. It causes her to have some vomiting and diarrhea, but she has received contrast previously with prednisone and Benadryl prophylaxis. Social history and family history, nothing significant found there. Uveal systems otherwise negative, other than what's been mentioned, other than she had a 16-pound weight loss in the past month.
Really?
Decreased appetite and some weakness, otherwise, as mentioned before. On exam, one of vital signs when she came in, she was afebrile, 37.4, heart rate was 62, blood pressure is 150 over 51, respiratory rate was 18, and standing well on room air. In general, she's thin, alert and oriented, very pleasant, very nice, no acute distress, sitting, talking, very cooperative and very pleasant, no acute distress. On exam, pertinent positive negatives, regular rate and rhythm, normal S1 and S2. She does have a 2 out of 6 systolic murmur, best heard over her left substernal border above about her fifth rib. Lungs were clear, abdomen, scaphoid, soft, tenderness to palpation over her epigastrium, but no rebound, no guarding. Normal active bowel sounds,
Okay.
non-distended, no masses that I could feel, no hepatosplenomegaly. Rectal, he was hemoccult blood negative, brown stool in the vault, normal rectal tone. GU exam was done by the ED attending who said it was normal.
Okay.
Labs, CBC, CMP, normal, other than a slightly elevated lipase. UA was also negative for anything. So, in essence, 87-year-old female, multiple comorbidities, including irritable bowel syndrome, history of pancreatitis, history of gastritis, pancreatic pseudocyst, here with epigastric pain for 3 weeks, decreased PO intake, elevated lipase, and some weight loss the past month. So problem list other than that, she is decreased PO intake, elevated lipase again, afebrile, however, no leukocytosis, normal LFTs, and hemoccult negative. So we're thinking that this is likely another case of her gastritis,
Okay.
given her symptoms and her labs. However, given her comorbidities and her other symptoms and history, differential includes episode of pancreatitis. She has elevated lipase. She has pancreatic pseudocyst, so this could be pain secondary to that. Peptic ulcer disease and irritable bowel syndrome also on the list. So what we'd like to do, when she came in yesterday, we made her MPO, gave her some IV fluids, started her on a proton pump inhibitor. She's feeling a little bit better this morning, but still complaining of some pain.
Do you know what the level of the pain is now?
The level of pain is about 6 out of 10 when I saw her this morning, down from 10 out of 10 when she
good.
came in. So it has decreased, but still some significant pain. So we've ordered a CT adjuvant with and without contrast. Given her history of an iodine allergy, we're going to pre-medicate her with prednisone and Benadryl before she gets that done. Once we see the results of that, we'll consider getting a GI consult, explore whether her pancreatic pseudocyst is part of this, explore the need for an ultrasound or an ERCP for drainage.
Good. You know how, you may have told me, do you know how high her lipase was?
Her lipase was 143.
Okay.
We don't have any other lipases to compare.
And her appetite this morning, is it back?
She did have a tray in her room this morning. Nothing was really touched on it. She was made MPO, however. So,
Good.
All right, let's go take a look and see how she's doing today, okay?
sounds good.